What we know for this outbreak is that in DRC first, so we are now counting about 4 cases detected in the province of North Kivu. And what we know is that all those cases are actually linked to the previous Ebola outbreak. So that's why we are saying this is a resurgence. This is not a new outbreak in DRC. For Guinea, we are also they have now recorded about 7 cases in Guinea. This is not related to the outbreak we had 5 years ago. But this is apparently a new outbreak in Guinea.
When we're dealing with a resurgence versus a new outbreak, are there some difference in strategies?
Operationally, what we are intending to do in both cases is to stop the spread of Ebola as quickly as possible, to bring what we call technically to bring the outbreak under control. That's what we're doing now. So the measure to achieve that objective, they are the same. We need to win over the community to work with us and to be part of the response and to abide by what we call public health measures, including at all costs avoid getting in touch with body fluid of person who's sick or who has contracted Ebola. And obviously the other measure, including, thankfully, now we have a vaccine, include vaccination of those contact of the person who have been in contact with the sick person. And of course, we need to track contact, to follow the contact. Any person who has been in contact with a sick person to be followed at least for 21 days and make sure that if she or he falls sick, it doesn't transmit to the next person. So in terms of approach and strategy, there are not much difference, but at least it's very important to know which situation are we dealing with. Because, for instance, we know that the vaccine that we're using in DRC is effective in one space of Ebola. So knowing that it's the same space is very important. You can confidently vaccinate people, knowing that they will be protected against that space of Ebola, and it will contribute to bring the outbreak as quickly as possible under control.
Looking at the COVID-19 outbreak, what are we looking at in terms of priorities?
I think public health-wise, there's no choosing between the two. They're all priorities. We need to deal with Ebola at the same time as we are dealing with the COVID-19. Obviously, as you can imagine, this is a challenge for the country. This is a challenge for our region, but we need to deal with this disease. But one hope, I can put it that way, one strength is for this region and for these countries, these are the outbreak they are kind of used to dealing with. So they have the capacity, they have the know-how, they have the institutional memory. So we are going to tap into that and to tap into the community strength, the way to bring them over and to make them part of the action to bring this outbreak as quickly as possible under control.
Many experts have said that lessons learned from West Africa and Congo have helped in tackling COVID-19 on the continent. What are some of those lessons learned? And does this mean that Africa is better prepared now to address Ebola?
No, I think it would be presumptuous for us to say Africa is better prepared. Obviously, where we were before the Ebola in 2013, 2014, 2015 in West Africa, we are no longer there, obviously, in terms of getting prepared in Africa and getting ready to respond to outbreak. But it's also true that we are not quite where we want to be in terms of getting our country completely ready. For instance, I will give you an example in terms of laboratory capacity. When we got the COVID-19, only 2 countries in Africa could test COVID. But now we have all our 47 member states of the Afro region of the World Health Organization can now test the COVID. So they have made progress, not only in terms of laboratory, they've also made progress in terms of structuring the preparedness and structuring the response. As you can remember, for the COVID, for instance, in many of our African countries, they were swift to take action. Actually, some took even action even before they got a single case. So we can say, yes, they've made progress since then, but obviously we are not yet where we want to be.
So what is the greatest concern at this point with the resurgence of Ebola outbreaks in the DRC and Guinea?
First of all, we are expecting that Ebola can pop up. I mean, the ecology of our countries, the virus is in the environment, is there in the nature. So is the contact between human being and the animal, especially the wild animal, that at the end we have Ebola coming up in our community. So Ebola, we're expecting to have Ebola outbreak popping up here and there. But what we don't want is to have one case, 2 cases, or 3 cases, or 5 cases going into 100 cases. Instead of having one outbreak that lasts maybe 2 weeks, 4 weeks, a couple of weeks, but having an outbreak that lasts months, or if not years. That's what we don't want in Africa. And that's why we are trying to make our countries to reach that level of health security as soon as they get they detect cases, to deal with those cases and to bring the outbreak under control. As paradoxical as it can be, I'm kind of satisfied that we can detect, and we can detect when we are still having few cases. Several years ago, it was after several months when we have Ebola or an outbreak that has completely gone already under control, that people will wake up and say, oh, we have actually Ebola. But now countries can detect it when they still have 1 case, 2 cases, or few cases. That's, again, a sign of progress in terms of dealing with outbreaks in our region.
Is there more reasons for concern when Ebola is seen outside of the DRC because of the experience that the DRC has handling this disease?
As you can imagine, people could think, yeah, if it happened in DRC, they have capacity, as I was mentioning, institutional memory. That's true. But let me also bring here a kind of caveat, Leonard. Every outbreak is a different outbreak. That's why countries need to get really prepared before an outbreak occurs. You remember, we were actually kind of saying the same thing when Ebola happened in Eastern DRC, because they were just coming from the 9th outbreak of Ebola in DRC. And when it came to the 10th, we were saying, oh, it's in DRC, they are going to do well. And to our surprise, it was a big challenge. And you remember that we had more than 3,000 cases of Ebola in Eastern DRC. Why? Because each outbreak is different. Why is it different? It depends with so many factors. It depends with the context. It depends with the community. That's why I'm insisting from the beginning we need to bring in the community. So it depends with the community. It depends with the local capacity, not national capacity. National capacity is important, but local capacity. It depends also with the vulnerabilities of the population that is affected, vulnerability of the health system that is affected, which can vary not only between countries, but even within countries. So these are the parameters that we need to take into account when we have an outbreak somewhere.
And finally, with the COVID-19 pandemic in full swing, what will it take to fight Ebola successfully while keeping the momentum in the fight against COVID-19? And what are the challenges and opportunities of addressing Ebola outbreaks during COVID-19?
When you look at Ebola and COVID, they might look different diseases. Yes, they are very different diseases in terms of mode of transmission, but in terms of prevention measure, they kind of have some common measure of prevention. For instance, for Ebola, we are providing people to avoid touching any fluid, bodily fluid that have been in contact with a patient or from a sick person. So for COVID, we are also advocating for social distancing, as we are calling it social distancing, but I prefer the term physical distancing because we need to remain socially connected, even though we are physically distancing ourselves. So those are the measures. For the Ebola, we have other tools, very powerful tools, like vaccine. But you remember that even though we have vaccinated now, but in Africa, many countries are still yet to get the vaccine. And true, because COVID is widespread in the country, is the whole country basically which is affected. We are dealing with the whole community, the whole population, while Ebola usually is in one localized either district or zone or even a village. So the measures are kind of the same, but at the same time, they are different, and we apply different approaches.
Dr. Ngoy Nsenga, thank you so much for joining us today. We appreciate your time.
It's my pleasure, Linord. Thank you very much for having me again today.